Welcome to part 2 of our podcast, where we explore barriers, impact, key ingredients and advice with our guests Eilidh James from North Ayrshire, Steve Sweeney from Perth and Kinross, and Fiona Hewitt from Renfrewshire. It's been really good to speak about all the work that has been going on already, but would you be able to tell us a bit more about the barriers you faced in this line of work?
There's been quite a number of barriers. I think the initial barrier for me was the staff feeling overwhelmed, and from that, their perception that they weren't mental health trained practitioners, so that impacted on their confidence to engage, really. And so working along, in actual fact, I'd have to say that working my way around all the kind of guidance and support teams, there was a lot of stress. And so the mental health and well-being of staff needed to be taken seriously. I felt that they needed to be heard and have their feelings of stress validated. And they weren't just making it up. Like a guidance teacher's role is, it's I don't even think there's a proper job description for guidance teachers, but they're expected to do so many tasks. And I liken schools as being like kind of mental health resource centres in many ways, because when I go in, there's always a queue, of young people wanting to see you're smiling, Fee, they want to see their guidance teacher. And of course, the guidance teacher is like wanting to do their best, but they've maybe got 2 minutes to spend with this young person, and that's not good enough. And the spaces that young people perhaps find themselves having to have really private conversations, they're in a public space perhaps, it's in a guidance room, there's people milling about, and so resources can be a big barrier as well to having private, safe conversations. Everybody's trying their best, but so this whole theme of time, space, compassion really is one to be cracked.
I think that's completely resonating with me, Steve. That time, the main barrier being finding time for the pastoral. It's like a revolving door being a pastoral support or guidance teacher, and Fee, you had spoken earlier on about looking after the well-being of our staff as well. But I do feel that one of the main barriers to that, quality implementation of suicide prevention strategies across an establishment, it does come down to time. It does come down to having that space that you can use, just as you described, Steve. And I also think there's a bit of a lack of suitably qualified assist trainers, safe talk trainers. It's really difficult. We're lucky we've managed to get a few more staff members trained in North Ayrshire, but you can never have enough because there's such a huge amount of need out there and a huge appetite from staff to build their confidence. So I think, that time, space. I think there's plenty of compassion, but I think the time and the space is probably what is one of the barriers.
I think I found this question quite a difficult one, really trying to think about what the barriers have been, because I think I've actually been really lucky in that, because I know the job well that people are doing in schools, I know the need that's out there, and I think Eilidh will probably agree that does make a difference around your suicide prevention work for schools. So I wouldn't say I have had barrier, because we were coming out of a pandemic and there was a much greater focus on the mental health and well-being of children and young people. I feel that my job has really been embraced within my authority, and the need for staff to have, the best skills possible in order to do their jobs has been really recognised. And Steve, you were talking about the qualifications. You need to be a guidance teacher, and I'm going to give away my kind of age here, but when I became a guidance teacher in 1997, it was expected that you did a postgraduate qualification in guidance and pastoral care, And that was an expectation of all staff that went into a pupil support role, and that kind of disappeared a bit. It has come back. I know that Education Scotland is running courses now, but really you could, as I gave the example with the GraphCom teacher, you could go from the classroom one day to a completely different job the next day. And actually the only essential criteria, I think, for a principal teacher of pupil support is good communication skills. And obviously those are key, but we need to make sure that our staff in those roles, now that we know the themes coming through for our young people because of our counselling services and the reporting that we have to do to Scottish Government, we have to make sure that they are supported, because the type of conversation they have with a young person who's really struggling can be really, I'm sure Jess could probably comment on this. It's so important that we get it right, and it's so important that we lead that conversation with knowledge and compassion.
Yeah, just as you were speaking, I was just thinking about some of the other barriers that are faced, and I think that the system in general, so not just within education, but health, social work, police, those systems in general are all struggling with volume. The police will tell you that they are dealing with, huge increases in mental health issues when they're called out, and they don't necessarily know what to do either. Social work are really struggling. Absolutely, since the pandemic, it has an impact. And one of the barriers there was getting social work to see that suicide prevention is a child protection issue. But how do we engage those systems to work together and take mental health seriously when we're dealing with trying to keep kids alive? And similarly, in a health setting, people will tell you it's getting harder and harder to make a referral that will be taken up. And so the barrier that I experienced was that people were very much in their own kind of silos and thinking that, why are they not doing their job over there? And it was a kind of us and them culture that had developed over the years. And so I saw my role as trying to let everybody appreciate that the system in general is very stressed, and that we have to build that compassion into our colleagues and start speaking and sharing so that kids actually get a service from adults who communicate to each other.
I know you're going to ask us, Jenny and Jess, about some of the differences that we found about this work. But just when Steve was talking there, sort of maybe about that sort of multi-agency way, we have one of our strengths and one of the key differences that we found in North Ayrshire is through the development of the Youth Suicide Prevention Task Force. It is a subgroup of the Child Protection Committee, and I think that resonates with what you've said, Steve. This is a child protection concern, and it is a multi-agency. There's police, there's CAMHS representation, there's public health, education, health and social care, youth services. Apologies to anybody listening if I've missed you out from our Youth Suicide Prevention Task Force, but it's two-pronged, the work that we do. We have the oversight of all the youth suicide prevention work that goes on across the local authority at all levels and within all multi-agency organisations. We also have third sector representation. Also, if in the tragic event of a young person dying by suicide, the group come together and ensure that there is a proportionate multi-agency response to the situation which supports everybody that's involved. And a key strength of that is that we've been working together for a number of years, since 2017, and we have developed trusted, professional, respectful relationships across the piece, which means that within North Ayrshire, suicide prevention is every agency's business. And I really feel very proud of the work that has gone on within that to ensure that that's the way we are.
I guess now that we've kind of discussing impact, does anybody else have anything that they'd like to share on the impact of their work, be it for teachers themselves? We've heard you all talk about the stress it puts on teachers and teachers' well-being. So I think that would be really interesting to hear, but also for parents, young people, or anyone within the community.
I'm going to go back to the GraphCom teacher. The basis of the conversation when we were talking about his background and the different types of conversations he was now having was that he came to our training that we were running saying, I did it. I was able to have that conversation. He just completed assist. And, he felt so, I think, possibly relieved that he was able to actually ask that question, are you thinking about suicide? Because we do get worried about asking that question in schools. You worry that a parent's going to be angry that you're putting an idea into a young person's head, but which is it's just not the case. But to hear staff saying I was able to do it, I think is the best feeling ever. To know that the training that you're delivering, the support that you're providing through resources is all making a difference. It's just worth its weight in gold. And I wish I'd had that training when I was school based.
And Ailidh, was there anything, I know that you spoke earlier, I suppose, about impact, but was there anything else, I suppose, while we're focusing on that topic that you'd want to share?
I do think that what's reported to us is that increased confidence in being able to speak about suicide without that taboo and that stigma around it. So I think that's probably been a big success, through the communications campaign that Youth Services developed. These posters are up all around our establishments, trying to embed suicide prevention within the PSE curriculum. Again, whilst it's probably in earlier stages of implementation than I would like, I do think that the feedback I'm receiving is that that it is reducing that stigma and reducing the taboo around having these conversations. And I think research tells us if we can all get talking about it, that has a strong role in preventing death.
I just wonder, has any of you ever actually had feedback, like informally or formally, from young people about the kind of work that's going on with you all?
Yes, we specifically asked young people. We have a youth cabinet that meets termly, and at the last youth cabinet, we asked a specific question. We introduced the concept of time, space, compassion, creating hope together, and we really wanted to understand what young people think works. What makes you feel hopeful that we can make a difference? And most of the time it was around that building confidence within young people to have the conversations, but they also spoke about that universal mental health and wellbeing curriculum that we can have in schools. So they're telling us that's what matters to them and that's what provides them with hope. So I'm hoping, sorry to keep using the word hoping, but I hope that the work that we're doing then does have that positive impact for them.
Yeah, I suppose we're lucky in Perth and Kinross in that we have a marvellous service called the Lighthouse Service. And so our strategy is that we've created a pathway for children and young people, and that schools know about this. So if there is a need for a crisis or a rapid response, then kids can access the Lighthouse Service immediately. They've got a hotline, a 24-hour kind of access through either online or physically going down to the premises. So, and they will work with that young person and their family if need be to reduce the risk and to develop that safety plan and get people talking to each other. And then once things have been kind of settled down and recognised, then schools can pick it up and take over. And so there's a kind of journey approach to this, which works really well. And so young people tell us through that service that they might not be alive had it not been for that. So that that's that's a lifesaver. You know, that's just like, that's what it's all about. So,
Jess, in Renfrewshire, we looked at collating the voice of young people through an evaluation at the end of last session around our new resource. It's a mental health thing, so that we could feed back to Headstrong about how effective it had been. But obviously to look at, was it meeting what young people wanted? And the feedback was really encouraging. It was really good to see young people saying, yeah, we know where to get help from, or these are the types of conversations we want to be having in school. So that was really encouraging. And I think just the fact that it came from young people in the first place was just really, I think it showed where we place them, how important their views are within our own authority. So it's encouraging to see that we've met the brief there. I work really closely with our youth services colleagues too, and we looked at what young people were wanting around PSE just before the pandemic, and we basically had a list of areas they wanted to see addressed. And it's great looking at that list now and thinking, well, we've done that. That's really good, but what are we going to do next? So yeah, it's I would say that we're confident we've met their brief, but we can always do more. And it's about looking at, things change, society changes, challenges for young people changes. How do we keep up to date with all of them now?
No, thank you, everybody. The last question I have is actually thinking about what's been key. There's been quite a lot of discussion around sort of professional learning, and whole systems working and working with partners. And something that I guess, Ailidh, you touched on, kind of struck a chord with me, is about trust and relationships across the different partnerships. Would you say that that has been the key thing in your work? And if so, why? And if not, what is? And why that has been the key thing?
Meeting together on a regular basis has made sure that we have developed these strong relationships. And when we've come together at a time of crisis, and manage the situation together, that really ensures that we have developed that trust with each other, and been able to debrief with each other, and understand where we may have got it a bit wrong, but respectfully be able to discuss that with each other. I think that's a key strength. And like I said earlier, suicide prevention is everybody's business, and I do think that having the relationships together has solidified that.
yeah, I would agree with that. I think people need to feel safe to have conversations. That's the key. So you have to invest in relationships, and for children and young people themselves, that work needs to start way upstream. We need to be able to. I mean, I think when we look at the data of how many young people die by suicide after they leave school up to the age of 26, that kind of thing, it's a real at-risk group. But when you look at all the reasons why potentially that they've died by suicide, it points to the fact that they're not connected in many ways. And so, what has, to people. So what has gone wrong? What do we need to focus on? And I'm just really aware at the moment that for the past 3 years, I've been just kind of looking at the crisis level, trying to settle things down with that. But we need to start working way upstream, nurturing relationships, taking very seriously the adversities that kids experience in life, and properly analysing that. What is the impact in terms of their developmental attachment? Have all the traumas that they've experienced been processed, or are they left to fester? And so that when they reach adolescence, it gets exacerbated. And when they leave school, if it's still not been addressed, then the risk has increased massively. And so the kind of area of transitions work into adult services is really, really important. It's a big neglected area, I think. We could do so much better with that. Another key point for me is for young people to have it validated that what they're experiencing is very real. They want to feel listened to. They want to be believed, and they do need that sense of hope. So being able to understand all of that and communicate that and share that in the context of a safe, trusting relationship is absolutely key.
I would absolutely agree with what Steve said. This isn't just about having a conversation about suicide, it's about having the awareness when people are struggling so that we are supporting children and young people at the earliest point possible. And again, I always go back to making sure our staff feel comfortable having those conversations. Certainly, collaboration with partners has been absolutely key to my role, and networking and knowing who's out there. And I couldn't have done it without our suicide prevention lead, Douglas. And I think there's been a real appetite within our authority to get it right, to make sure that we have that community that's safe from suicide. So yeah, partnerships have been really the thing that's made it work, and that appetite from everybody to get it right for our children and young people.
Well, thank you all so much. I think that the last thing we did want to ask was if you could give advice to anyone undertaking work in this area, what would it be? What advice I suppose it could even be advice that you'd give yourself at the start, or it could be advice that you would give somebody new to working on this.
I think Fiona sort of summed things up very well when she was just finishing there about making a difference to the young people. But I think I just can't go back. I can't talk more highly of how we develop our relationships. They are central to it all. So I suppose if I was to go back and give some advice to myself at the very beginning of the journey, is just keep on being tenacious and don't give up. And there will be setbacks in this work. There will be times when you feel that you're not making a difference, but just keep on going, keep on building these relationships, keep on keeping the children at the centre, and hopefully you'll do okay.
I would agree. I'm going to put my other work hat on, my therapist hat on, and say that you've got to look after yourself. You've got to be kind to yourself. It's a big, important topic. It's a topic that can trigger a lot of people. So just making sure that you've got that support around you in this type of role. I think we've all said the importance of partnerships, but it's also about supportive partnerships for you too.
Yeah, people will remember how you made them feel. So make sure you make people feel good.
I think it's just kind of like echoing what everyone has said, like that is the time, the space, and compassion. And I know kind of across the country, that is probably where a lot of people are struggling to have the capacity to give. But as well, yeah, I kind of just exactly what Steve just said. I say that a lot to people as well. People remember how you made them feel, not necessarily what you've said, and that is what's most important. Ensuring people do feel held, heard, supported. I don't think any young person is expecting a perfect response. I think they just don't want a negative response, but there's no such thing as that perfect response. So I think just meeting people with compassion is the most important thing. And yeah, I think it's just really encouraging to hear all this positive work that's going on across the board. It would just be great to see how maybe different areas, like because I'm rural, I just sometimes feel we maybe feel a bit more out of touch with other things that are going on. It would be really great to see like maybe how different places can connect and work together and like share knowledge on and good practice and things like that as well. I'd like to thank Steve, Fiona and Eilidh for joining us today on the Creating Hope podcast, and I'd like to thank you for listening.
If you're a practitioner working on this topic and you would like to connect and hear about work happening across Scotland, then please join us for our bi-monthly Children and Young People's Local Suicide Prevention Forum. The sign-up details are in the podcast notes.
This podcast sits alongside a resource drawing together practice concerning taking a whole school approach to suicide prevention. This resource can be found in the podcast notes. Lastly, if you're concerned about yourself or someone else you know, please know that help is available. You can call Samaritans on 116 123 or use their online chat function at samaritans.org. Alternatively, you can contact Breathing Space on 0800 83 8587. You'll also find the NHS 24 Mental Health Hub, where you can speak to a specially trained mental health advisor by dialing 111. And if you are ever in immediate danger or have the means to cause yourself harm, you should dial 999 and request an ambulance.
Thank you again for listening, and take care.